Minnesota counties and the Minnesota Department of Health and Human Services are under scrutiny for poor oversight of benefits programs. Two parts to this question. What are your thoughts on this scrutiny? And secondly, what should be done to ensure assistance programs are not being taken advantage of?
There's always been people who try to take advantage of the system. That's not a new thing. And what the problem is, we need to have more people to help oversee the many programs that are out there that people can take advantage of. And that's unfortunate because it means adding more workers to the already growing workforce at the county. We have close to 400 employees at the county and over 100 in social services. And that's primarily where the issues are. People are trying to take advantage of programs we have offered. And again, it's not a new thing. It's been going on forever. We'll do the best we can. You're not going to catch it all, but we're trying to stem the tide of the bad people who are taking advantage of the system.
Well, I think anytime we have a government program, there's a responsibility to all citizens of the county, the state, that the program's being run efficiently, that there's proper safeguards there, and that the monies that are expended in it are being spent wisely. I think we found, and this is one area that's going to be new for me going into county government, is that whole element of the social services that are out there, and it represents a significant piece of the budget for the county, state as well. But I think some of this is certainly well deserved. Probably some of our problems that we have in those areas is probably related to budgets. I think we've heard that, particularly up in the metro counties where I've said they're largely understaffed to be able to handle some of the issues that have been developed out there. So I think we have to look at that. When we get to the county level, a lot of the expenditures that we've got and how we handle those programs are really mandated by state and federal agencies. So there's some areas where we're going to find ourselves hand-tied on some things, but it doesn't mean that we shouldn't have adequate and proper oversight. Certainly the audit process, and audit is a fairly comprehensive word. I think a lot of times we think of audits just as a financial situation, but they are much broader than that in terms of, are the services that we're delivering out there, are they actually getting to the right people? Are they serving the needs of those people? So I think we do need to keep an active role and a check on those programs. Sometimes I think we can have programs too that maybe started out with great intentions, but over a period of time, some of the needs change and the program doesn't change accordingly, so we're really meeting the correct needs of that group we're trying to have an effect on.